Hey guys, today I want to go over what we do for the soft tissue and the internal joints for whenever we're treating our shoulder pain patients. So a lot of times we're treating shoulder osteoarthritis, shoulder degeneration, maybe even some labrum problems. So we want to make sure that we get extremely deep into the tissue. Not a lot of things can do that, right? So we're talking about internal shoulder, right? So we've done our exam, we've ruled out that the problem is coming from the neck through our orthopedic testing. We've already also ruled out that it's not rotator cuff. Do we treat the rotator cuff? Absolutely, of course we do. And we actually treat some of the rotator cuff muscles during this treatment. But it's not the primary, pain generator, and it's certainly not the prime and most important tissues we're trying to hit, okay? So we actually use two different types of Shockwave during this treatment, especially for the shoulder. We're gonna use something called radial, which is a little bit more like a pressure wave, and then we use focus, which is true shock waves, okay? So radial, I'm not gonna turn it on, it's really loud, it's really kind of noisy, plus it's gotta be skin on skin. So we're going to use the radial. The radial is best for breaking up a lot of the muscle spasms and the tightness and the stiffness in the muscles. So we're going to kind of hit the top of the shoulder, the upper trapezius muscle. We're also, this is also where the supraspinatus muscle lives, which is part of the rotator cuff. Definitely along the deltoid, you're going to get a lot of stiffness and tightness kind of like right below the AC joint. So hitting this area right through here, you're gonna feel a lot from that, and you're definitely feel a lot better after we do it. So even a little bit lower towards the deltoid, we'll even probably hit a little bit of the mid-back. So when you get all of these supporting structures with radial, all of the musculature, you help with some of the mechanics of that. You take a lot of stress off of the internal shoulder, and we're able to kind of like help the internal shoulder heal a lot faster as a result. Meaning that if you fix the internal shoulder but you don't work on any kind of the supporting structure, well then either this is going to come back faster or it's just not going to feel better at all, okay? So we're going to start there. We always usually start with radial. We're trying to hit these big muscles, and then we end with focus shockwave. So focus shockwave, the reason why it's so cool is it can go super deep. The radial doesn't go incredibly deep. It starts at the surface, and then as it goes down, the power of it dissipates. Shockwave is the other way around. It actually can get, the most powerful part of it is, up to like 2.5 inches deep. So we can aim directly inside that shoulder where the labrum is, where the arthritis is, and the maximum amount of power and energy is actually going and being delivered exactly where we want it, okay? So we've got a couple of different head pieces that we can use that will actually change that depth. For the shoulder, we want to go nice and deep. We'll be able to get that arthritis. It's going to start to help the healing. It's going to break down damage. After that, stem cells flood the area and help build up brand new baby tissue from growth is kind of how baby tissue from scratch is how I describe it. Of course, it's going to help with pain, but we also get neovascularization, which is a fancy way of saying that we're going to get a lot more blood flow to the area. And anytime that you stimulate extra blood flow to tissue, you get better healing. Okay, so that's one of the main reasons why we're going to use it as well. Okay, now we can use a longer headpiece, and when we use a longer headpiece, we'll actually be kind of hitting maybe a little bit more of the rotator cuff tendons. We wouldn't do that for this treatment because we're trying to get down inside, but that is how we treat our rotator cuff patients. Okay, so it's kind of a go. If it's just mostly more muscle type stuff, we would stick to either some shockwave. Maybe we would do dry needling instead. But if you're coming in with some internal shoulder arthritis, degeneration, labrum problems, then we're going to be using the shockwave to get nice and deep. Thanks, guys.